Okay, so the first thing we need to go over with X-rays, especially ortho X-rays, kind of like you guys did with chest X-rays, is how do you approach an X-ray? There should be a systematic way you approach it, and I'm not saying my way is the right way, but I'm saying that it's the way that I do it, and it's the only way I really know how to teach it, and in a very systematic way. And so I think it'll help you guys if you approach X-rays in a very systematic way. Especially when it comes to ortho X-rays, it's so easy. Sometimes it's so easy just to look at the big blaring fracture or dislocation or something like that. And if you're not systematic, you'll miss something really subtle like an avulsion fracture or just some soft tissue changes that may indicate, an occult fracture, something like that. So we're going to go through this systematically, and hopefully this will help you to know how to approach ortho X-rays a little bit better. Okay? So here we go. If I can get this to work. J stands for joint space. Okay. Joint space can be narrowed or widened. Okay, and I'll show you a picture of this here in just a minute. So I know what you're thinking right now. You're thinking, well, how do I know if it's narrowed or widened? And that can be a tricky thing because everyone's going to have different widths of their joints. But you'll understand here in just a minute when I talk a little bit more. Not every single X-ray is necessarily looking at the joint space particular is going to have a problem with the joint space. The big ones are the knees, the thumb, the wrist, that kind of stuff, and we'll kind of go through them. You can compare both sides to determine whether one is narrowed compared to another. Anyway, we'll go through it here in just a minute. You'll understand a little bit better. Narrow space may indicate that there's arthritis there, or it could be a fracture, like a compression of the joint space kind of fracture where you've got a convoluted type fracture or something like that. Impaction is the word I'm looking for, an impaction type fracture. That can cause narrowing of the space. But usually what narrowing of the joint space and what you're going to see most of the time is arthritis. Okay, that's the most common finding with joint space abnormalities is joint space narrowing. Widening of the joint space, meaning it looks abnormally large, and it doesn't have to be the whole joint. Say this is your ulna and this is your carpal bones. It may just be angulated like this, or it could be separated the whole way, okay? That indicates ligament damage, possibly, or a fracture. But why would it be ligament damage? Well, those joint capsules are ligaments, and so when those are ruptured, then you're going to have some sort of ligament damage, okay? An example of that would be when you do a shoulder X-ray and you see a shoulder dislocation, okay? And you see the head of that humerus is clear down over here instead of right up here where it should be. Okay, and that indicates that there's some sort of ligament damage and possibly a fracture there. Okay, so that's why we look at joint space. And so let me show you a couple pictures. Here's a common one that you're going to see problems in joint spaces in the knees. Okay, and this is a lot of times why we do knee X-rays to determine if there's arthritis there in those knees, determine if there's fractures, that kind of thing. People will come with chronic knee pain, and this is what their knee is going to look like, just like this one over here on your right hand side. So you see how over here, this is a normal knee. You can see the joint space is nice and wide. You can see a nice clear space. That's cartilage that's in there. Okay, it's not necessarily those bones are just floating there. Remember, there's cartilage, there's meniscus in here. That's giving this gap here. And so you come over here and look at this side and notice that there's a nice gap over here, but over here there's no gap. That means that cartilage is worn away. That meniscus is gone. They're bone on bone right there, and that's what's causing their pain. And when you're bone on bone and you have more friction, you grow more bone. So notice that there's thickening, more calcification in this area. I'll show you the next slide, kind of illustrates that a little bit better. Again, here's your somewhat normal knee. Again, there's a little bit of calcification right there. It's not as smooth. But notice over here, that's almost, looks like it's almost fused together. But can you see how it's nice and thick and calcified right there? That's because you've got a lot of bone growth going on in there, and it's because of friction. So this is osteoarthritis, very typical X-ray for osteoarthritis. And you can see this really in any synovial joint. So you see it in their fingers. You'll see that that joint just seems to be kind of coming together. There's not a nice little space there. Anyway, that's kind of what that looks like. Now, if you had joint widening, I don't have a picture here. I couldn't find a great picture I loved. It's basically going to be looking like, let's go back to this picture. It's going to look, this is normal, right? It's going to be a wider space than that, okay? And usually you can't really tell unless it's really drastically wide and it looks really abnormal. And you may not see it in the knee. It's usually in things you can dislocate. So you're going to see it in like finger joints. You can see it in the shoulder. You can see it in the elbow. Those kind of things where you see an abnormal joint space. It's abnormally large. And usually it's one side more than another because it's kind of gapped open like a wedge shape there, something like that. So you look at joint space first, okay? Next, A is adequacy or alignment. This one falls second just because jab sounded better than abj. So we put the J first, but you got to make sure that that film is adequate, okay? So what does adequate mean? You need to have 2 views to do a good joint evaluation, and we'll show you why here in just a minute. But you need to have good 2 views, and you need to have adequate penetration. With x-rays, under-penetration is your big problem. Remember with chest x-rays, under-penetration, you couldn't really see the bones very well, especially through the heart. Orthopedic x-rays, you want very penetrated. You may even want them over-penetrated. In fact, a lot of times to see really tiny fractures, you're going to use the contrast tool on your program, on your radiology program, to make there be increased contrast so you can see maybe more subtle fractures and that kind of stuff. So you want more to lean more to the side of over-penetration than under-penetration. And I'll show you a picture here of under-penetration in just a minute and why it's a problem. A also stands for alignment. You want to make sure alignment is appropriate, and especially in certain x-rays, alignment becomes very important. The ones I can think of right now are the elbow. If you do not have a true lateral of that, you're going to take a couple views, maybe even 3 or 4. You may need those to really evaluate that joint well. You get a view coming onto the arm this way, okay, and that's pretty easy to get alignment. You just lay it down on the table and right there. But then when you go lateral, you've got to make sure that they have a true lateral. If it's rotated at all, it's going to be really hard to read that x-ray appropriately because you can't use landmarks to really read it appropriately. A wrist is another one. A lateral on a wrist needs to be perfectly lateral. If it's rotated at all, you're going to have a hard time telling if the bones are really angulated. And that becomes important when we get to treatment, which we'll talk a little bit more. Angulation really determines whether they need to have a reduction of that bone or not. And so you've got to have good alignment for certain x-rays, and for all x-rays really, but certain x-rays are harder than others to get that alignment because it's easy to rotate the hand just slightly, or it's easy to not get that elbow right in the right position. And so we'll talk about how, especially for those 2 things, how to get proper alignment. Okay, so A stands for adequacy and alignment. Adequacy is basically adequate penetration, adequate amount of views. Alignment is making sure anatomic alignment is correct so you can read the x-ray properly. Kind of like what we talked about with the clavicles and looking for rotation in the chest x-ray. Well, there's those kind of things for every x-ray. Okay, here is an example of a hand x-ray. Notice it's really hard to see any of the carpal bones in here, the metacarpal bones, and it's hard to even see the proximal phalangeal bones. And that's because this is underpenetrated. They've tried to use the contrast tool on this to make it more contrast, but it just whites it all out because everything's white. It's underpenetrated. So you want to make sure there's good, adequate penetration. Again, leaning more on the side of overpenetration than underpenetration. Okay? If you overpenetrate too much, though, everything will just be too black and you won't be able to see much at all either. So good penetration there. B stands for bones. Obviously, we're looking at bones in ortho x-rays because you can't see cartilage, you can't see ligaments necessarily. You can sometimes see tendons, but not very often. So we're looking for bones here. And basically, what you want to look for is you want to make sure there's no disruptions in that cortex. And I'll show you what I mean here in just a minute. But you go around the whole bone. Don't just focus on the area where they have pain. Go see that whole bone. Look through that whole x-ray because you may miss something. Again, don't just go straight to the blaring problem. Look around it and be thorough and take that cursor. If it's on a computer, take that cursor and just trace around that bone and look at every little edge, every little curve on it. And fractures can be really subtle. They are not always very obvious. In fact, there's some fractures called occult fractures you can't even see on x-ray, which we'll talk about next. And so you get, and some that are just so tiny that you're just going to have to really look hard. Okay, so and we'll show you some of those so you can kind of get an idea what I'm talking about. So B stands for bone. Okay, here is an example of how we would examine bones in an elbow x-ray. This is obviously a blown up view of the central part of an elbow x-ray. Okay, you would come along, this is how I do it. I start at one end and just work my way all the way around. So come along, the cortex is right here of the bone. It should be nice and smooth. Okay, if there's any real disruption to it, it'll look kind of jagged or it'll look broken to that there'll be a break in that cortex. So far it's nice and smooth. I come all the way up into here. I see a little rough spot right in here. Can you see how this does not follow along with the normal pattern of the cortex? Possibly something going on there. Again, this is an elbow x-ray. I'll show you here in a minute, but one thing that you've got to look for is make sure that this is appropriate alignment. This is a lateral view. One way to tell is there's a figure 8 here, this humerus, and that tells you that it's a good lateral. Okay, so I'm seeing a little ragged spot right there, and that indicates there's a fracture right there. Can you see how subtle that is? It kind of comes into here. There's a little piece there, and on your other views you may be able to see it a little bit better. I don't have other views of this x-ray particularly. We know this is a younger person. We go through this bone as well. Make sure there's a growth plate here. Make sure the growth plate looks good. Make sure there's no fractures in here. Make sure that looks good. That looks good. Ulna and radius all look good. Okay, so humerus right there has got some problems, and we'll teach you in a minute. This patient has a fat pad sign here and here, anterior and posterior, which indicates that there is a joint space fracture, which is probably this thing going on here, okay, causing a hematoma. But anyway, that's basically looking at bones. You just go all the way around, really simple, okay? This is a lot simpler than doing a chest x-ray or an abdominal x-ray. You just, okay, there's just a few subtle tricks. Now this has really bad resolution, but I wanted to show you this just because hands can get a little more complicated, right? This could take some time. Radiologist may read this in about 10 seconds, but I have to take a little bit longer. I go around each bone. Okay, I know where the problem is already. I saw it in 10 seconds, but just 2 seconds you can see it. I'm sure you're looking at it right now in that fifth metacarpal, but make sure that you're going around every bone because you may miss something. Okay. Notice this is called a boxer's fracture, the fifth metacarpal. It's usually from impacting something or someone with their fist, and it's usually, this is actually a spiral fracture. As you can tell, there's a fracture up here, and then it kind of spirals down into here. So this is a spiral fracture. A lot of times this is why can I not remember this word? It's an impaction fracture, okay? Because you're punching into something, that force causes that bone to compact on itself and causes spiral fractures. It can be just the head of this metacarpal can be pushed down, but a lot of times you'll see just, you know, a nice impacted fracture there. Okay, and make sure you're going also through the phalanges here. Make sure there's no fractures there. I don't see any fractures anywhere else. Also look at the carpal bones as well. Capitate, hamate, all those in there, trapezoid. So make sure you're looking at that. So this is an example of another one. Again, I brought this up because there's a blaring fracture there. You can see it, but you know you've got to go through everything. In this case, it was all normal, but make sure you go through everything so you don't miss something. Okay. S is our last one we need to talk about. So we've talked about J, we've talked about A, B, and now we're on S. S is soft tissue. Soft tissue becomes important when you can't see a fracture and you see some soft tissue signs. Okay, it becomes very important in elbow x-rays especially, also in knee x-rays, and we'll show you examples of those here or in class. So first you look for joint swelling and joint effusion. Okay, that's going to tell you a lot. If there's a big joint effusion and it's showing up on an x-ray, that's likely that there's an occult fracture, meaning there's a fracture hiding there that you can't see, and you treat it as a fracture. And I'll show you what I mean here in just a minute. Anyway, so it means a fracture, okay? Here's what I'm talking about. This is an elbow x-ray, again, a lateral. And again, we can see this may not be the best lateral because we've got, well, it is actually pretty good. We've got a figure 8 here. So that's showing that it's a good lateral, and don't worry about that. We'll go through that here in just a little bit with alignment. But there's a figure 8 there, so it's a good lateral. We know we can read this appropriately. And what we're looking for is soft tissue. So notice there is a change in color of that soft tissue, and I hope you guys can see this on your screen, but how it gets a little bit darker right there, and there's also darker right here, and you can tell by the arrow sign, positive arrow signs. I wish those were on every x-ray, but they're there. This indicates, so this joint capsule, the ligaments and the joint space extends up into here, and usually it's folded in on itself, and there's no space there. Okay, but it's called redundant joint capsule. So it comes up in here and comes up in here. Well, when you get swelling in that joint, you get a fracture or you get some sort of trauma, that joint space that's normally closed and those two edges are usually stuck together can start to fill up with fluid. Okay, and when it starts filling up with fluid, and especially when it's a hematoma or blood in there, you start getting this fat pad. It's called a fat pad sign. The anterior fat pad sign and the posterior fat pad sign. This is also known as the sail sign. The anterior fat pad sign is a sail sign. Looks triangular in shape usually. It looks like a sail. This indicates that there is a fracture in that joint somewhere. Okay. Now when you go through the bones here, you look at this joint space first. Let's follow Jabs. Joint space looks normal. Okay. Alignment. Again, we did the figure 8. It looks normal. Then we go to bones. We follow those bones around. They look normal. Follow over here. That looks normal. Not seeing anything really. But then we go to soft tissue and we see these here. This indicates that there's a fracture somewhere in that joint. Okay. This rule only applies to elbows. Okay, so this is the big one. Knees have another kind of soft tissue sign that we'll show you a little bit later on in the lecture. But for elbows, this is the fat pad sign, okay, the anterior and posterior fat pad sign. You can have one or the other, or you can have both. And this indicates an occult fracture that you cannot see on X-ray, and you treat it, you splint it up, and you treat it just like a fracture, okay? All right, so that is Jabs, okay? And to review, J stands for joint space, A stands for alignment and adequacy, okay? B stands for bones, and S stands for soft tissue. If you follow those rules, and we'll show you some principles, some special principles to go along with each different type of joint x-ray, you'll be a lot further along than I was when I got out of school. And you'll be able to read a lot of these x-rays and be able to pick up a lot of the fractures and things that come up that you're going to see and know how to treat people a bit better. Okay, so that's a systematic way. It's really simple, really short, but it should work pretty well. Okay.